Hey, great job. I'm so glad that you've opted in to learn how to get your patients to get what you do and want what you offer. I'm Dr. Russ Rosen, and I help natural healthcare providers just like you build true health and wellness practices within 6 months so you can fill your schedule to complete capacity with your ideal patients without sleazy sales tactics, tons of marketing, or high pressure gimmicks. Now, during this short video, I'm going to show you the exact steps so that you can get your patients to get what you do, want what you offer, and happily stay, pay, and refer for a lifetime. Now, in just a moment, I'm going to drop into PowerPoint mode. If you've not already downloaded the notes and the brochure that you're going to need, you probably want to pause the video and do that right now. I promise you, as we go through this, you're going to want to take notes. So again, you'll have the slide notes as well as the brochure that you're going to need. Now, regardless of your license or where you practice, people all want the same thing. They want to feel better as fast as possible for as cheap as possible. Again, I don't care if you're a chiropractor, naturopath, osteopath. I don't care if you're a nutritionist, functional medicine, holistic medical doctor. It doesn't matter. I don't care where you live in the world. I've coached doctors all over the world. That's what people want. But my question is this: might they also want more if they knew they could get it from you? Might they also want to get healthy and stay healthy, resolve their problems, have the best life possible? And the answer is yes, but we need to bridge the gap. We need to close the gap between what they thought when they came in and what we know we can do for them. But to do so, we need to understand the basics of communications. We've all heard if they knew what you knew, they would do what you do, right? If they get it, if your patients just get it, they'll probably want what you have to offer. The problem is, what is it, right? They don't know what it is. We need to close this gap between what they thought when they came in. You can help me feel better. You can get rid of my symptom, neck pain, back pain, headaches, right? Digestive issues, hormonal issues, anti-aging, whatever it is, however you practice. They need to close the gap between what they thought when they came in and what you know you can do for them. Help them get healthy and stay healthy and have the best life possible. So how do we do it? Well, we need to learn the neuroscience of communications. It's the science behind how to get people to get what you're saying, how to get people to say yes who want to say yes. We're not trying to get people to say yes who don't want what you offer. We're not trying to manipulate them. But you need to understand that you can cause people to say no. In fact, I promise you, you cause people to say no all the time. So we want people to say yes. We want them to say it, mean it, and follow through with it. But understand, when you have an average conversation, we know research shows that people hear about 25% of an average conversation. The rest of the time, they're thinking about what they're going to say. They're thinking about what they need to pick up on the way home. Okay, so my question to you is, what percentage of your information would you like your patients to be getting? 100%. If you're going to be helping them understand how you can help them and what's going on with them, you would like them to get 100% of what you're saying versus 25%. And the only way to do it is by doing this, the neuroscience of communications. Now, I hear this from doctors all the time. I tell my patients over and over and over again, they just don't get it. They complain about the same things no matter what I tell them. They keep asking me the same questions. So tell me, why is this happening? It's happening because they're not hearing you, just like this teenager here is not hearing what this adult is screaming at. And that's what happens with our patients. They just don't hear us. Now, they look at us and they shake their head and they nod like they're listening, but they stopped listening a long time ago, and you caused it. I'm going to show you exactly how in just a second. So there's only one possible solution. What is it? It's to quit telling them. It's to quit educating them. It's to start to use the neuroscience of communications. Here's how this works. We got a brain, right? The reptilian brain, what does it do for a living? Well, it's all about survival. The 3 F's: food, fighting, and fornication. It's filtering all information coming up. Now, if it doesn't filter it, it will send it up to the neocortex for thinking, reasoning, and problem solving. That's where we need to get our information to. We're going to be teaching them about how we can help them, helping them understand what's going on. We need to get them to send their information through the reptilian brain to the neocortex for what? Thinking, reasoning, and problem solving. Now, if it makes it there and it makes sense, it'll drop it into the limbic system as a new belief system. This is where the emotions are. This is where all buying decisions are made. And this is where the new belief systems are going to end up. Now, we also have the amygdala. The amygdala is all about fight or flight. So if they're in fear, if they're in fight or flight, they're not sending information in the neocortex for what? Thinking, reasoning, and problem solving. So what do we want? We want our information, making it past their reptilian brain into the neocortex for thinking, reasoning, and problem solving. They'll drop it into the limbic system as a new belief system. That's our goal. That's what we want to accomplish. And my question is, what % of our information do we want getting up there? That's right, we want 100%. And I promise you, you can have it. I'm going to show you exactly how to do it. What if the reptilian brain is not sending information to the neocortex? What happens? Well, have you ever been sitting in class and you're kind of daydreaming and you hear a teacher saying, wah, 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 and that'll be on the test. Boy, and everybody put wrestling paper, right? What'll be on the test? I didn't hear it. Of course you didn't hear it, because your reptilian brain did not feel that this information was important. It wasn't about survival. So it didn't send it to the neocortex until it heard, and that'll be on the test. You've got new parents, okay? They're in a big town like New York. Sirens going by, trains going by, gunshots, really loud. They're sleeping just fine until their new baby cries and they wake up. That's the reptilian brain sending what is important to the neocortex for thinking, reasoning, and problem solving. I'm going to show you exactly how to get your patients to send your information to the neocortex right now. Okay, for the reptilian brain to send it to the neocortex, remember, it's all about survival, food, fighting, and fornication. Probably not a good idea to do with your patients. So we've got to get it to send it up past that reptilian brain. We need another idea other than food, fighting, and fornication. The way we do it is by making our information new, novel, and exciting. We make it all about them. We get the reptilian brain's attention and we keep it. Just like this cute little girl right here. We've got her attention, new, novel, and exciting. So how do we get the reptilian brain's attention and keep it? Here's the key. Ready? We speak from our neocortex to their reptilian brain. Do not speak from your neocortex to their neocortex. That's called educating, right? We hear it all the time. You got to educate. You got to tell the story. Well, it doesn't work. We need to speak from our neocortex to their reptilian brain, so their reptilian brain will find this interesting and send it up to the neocortex for thinking, reason, and problem solving. And the way we do it is we make it new, novel, exciting. We make it about them. We've heard the radio station WII-FM. What's in it for me? Make it all about them. So how do you do it? Don't make it about your story. They don't care about chiropractic. They don't care about BJ Palmer. They don't care about Benedict Lust. They don't care about your technique guru. They simply care about them. So we're going to make it all about them. We're going to use Socratic questions. We've all heard Socratic questions. It's really simple. Here's an informational question. What is your last name? Right. Now, did you learn anything, or did you already know that? You already knew that. Here's a Socratic question. I wonder what brought that on in the first place. Why do you think this is happening? Why do you think this isn't getting better? On a scale of -10 to 0 to +10, Where do you think you're at? Where do you want to get to? Those are Socratic questions that make people say, her? It makes them think. And that's what we need to do. We need to ask Socratic questions. We need to look at a window of opportunity. If we give them too little information, they go on frustration and they go on tilt. Reptilian brain shuts down, stops sending information up. If we give them too much information, we try and educate them and tell them everything about what's going on with them. Same thing, puts them on tilt, they stop sending information to the neocortex for thinking, reasoning, and problem solving. We need to find the window of opportunity. In our programs, we literally have a series of questions we're asking people in the consult, in the exam, in the report of findings. And each question, we know exactly what we're trying to accomplish. And when you accomplish it, you move on. So if my goal here is to build rapport and they start talking about nutrition, I will not start to talk about nutrition with them. My goal is to build rapport. That's what we're going to do. There's a time and a place to talk about nutrition. Okay, so we're going to find out exactly what's going on by looking for a window of opportunity, and then we're going to move on. Name of the game, get the reptilian brain's attention and keep it. Okay, so let's apply the neuroscience of communications to your examination. Now, in our world, we apply it to the consult, the exam, the report of findings, daily interactions, re-exam, re-reports, etc. I just want to look at one small piece that you can learn right now, go use tomorrow morning, and start to get your patients to get what you do and want what you offer. Now, it doesn't matter if you practice dealing with neck pain, back pain, headaches, if you're doing hands-on work, or if you're dealing with more metabolic symptoms. Now, I personally do styles of chiropractic, and at the seminars I go to, there are also naturopaths, osteopaths, holistic medical doctors, because they're doing the exact same kind of work. In our world, we call it a subluxation. There are doctors who call it nerve interference or inflammation or brain lobes, or it just depends on how you practice. So you would use the words that you use. But our goal is to get our patients to say, I have a health problem, not a back problem, and you can help me get healthy and stay healthy for a lifetime. Now, if you're doing more metabolic work, or you also do metabolic work, functional medicine, you might deal with gut issues or anti-aging, women's or men's health issues, stress hormones. And they already understand that it's health related, but we want to connect the dots for them and make the picture bigger. So they understand that you can do more than just help my gut get better. You can help me get healthy and stay healthy for a lifetime. Now we're going to use this skill set during the examination called touch, tell, ask, and teach. You're either going to actually be touching the person because you're doing hands-on work, or you're going to be looking at a questionnaire with them and you'll be touching on it. And I'll show you exactly how to do that in a moment. Now you're going to use this phrase over and over and over again. Oftentimes, if you have a blank causing blank, we'd expect to see blank, and that would make sense because blank. So if you're a chiropractor and you're talking subluxation, that would be oftentimes if you have a subluxation causing blank, we'd expect to see blank, and that would make sense because blank. But again, you might be a chiropractor and you're using the word nerve interference or inflammation. You might be talking about brain lobes. You might be doing more metabolic work, spit, pee, and poop test, functional medicine, and you'd be talking about hormone imbalance or cortisol problems. But the phrase is going to be the same no matter what. You're going to see, you're going to connect the dots. You're going to go to the chief complaint. You're going to connect it to the spine and nervous system or to cortisol, whatever it is you're talking about. Motor, sensory, autonomic, go to the next area, motor, sensory, autonomic. Then you're going to prove your case. And we're going to predict, predict, predict. I'm going to show you exactly how to do that right now. You're going to see that I gave you this handout right here. And this is specifically for chiropractors who use the word subluxation. Regardless of how you practice, you can use a very similar one to this. You can, download this one and then make your own. But you'll see in the left panel, we have the chiropractic premise. Nervous system controls everything. If you're getting proper nerve supply, you got the best chance of being healthy. If you're not getting proper nerve supply, what we call a subluxation, it could be causing your health problems. Our goal is to find if you have that going on, correct it, and show you ways not to recreate it. Now, if you're a naturopath, you might have the naturopathic premise, right? Whatever it is, however you practice. You'll see in the center panel is what we call the whole story, and we'll go through that. And then there is, do you have a back problem or do you have a health problem? The same nerves that control your back also control your health and wellness. Now, on the inside, it's what we call a classic Merrick chart. So we've got the body, the spinal level, classic body pain, the type of internal organ or body malfunction, and the common kinds of symptoms they would have autonomically. Now, you could use a very similar chart like this that could be a hormonal questionnaire or stress hormones or cellular toxicity. I coach doctors that use all of these: heavy metals, biotoxins, methylation, microbiomes, cellular inflammation, brain toxicity, etc. So it doesn't really matter. It just depends on how it is you practice. So you can either have them fill these out ahead of time, right? Take your hormonal questionnaire and have them fill out their symptoms, or take this questionnaire and have them fill it out. Or you can do this during the examination. I'll show you both ways. Okay, so let's assume that you're a chiropractor using the word subluxation, and you're going to use your touch, tell, ask, teach. First thing I'm going to do is take my brochure, I'm going to put it on a clipboard, and I'm going to talk to the patient and say, hey, can you do me a favor? Can you help me take notes? So you're going to circle and you're going to underline for me. So they have this right in front of them. They can see it and they can read it. And I'm going to use this phrase right here. Oftentimes, if you have a subluxation causing blank, we'd expect to see blank, and that would make sense because blank. And I'm going to use that phrase over and over and over again. I'm going to connect it. The chief complaint, let's say their chief complaint is right here. I'm going to connect it to the subluxation, the spine, the nervous system. I'm going to talk motor sensory autonomic, right on here, motor sensory autonomic. I'll move to the next area, motor sensory autonomic. Then I'm going to prove my case, range of motion, posture, scans, x-rays, spit, pee, and poop tests, whatever it is you do. So let's assume they have headaches here. Here's what it would sound like in real time. Listen, show me exactly where your head hurts. Oh, right there, touch it. Listen, oftentimes, if you have a subluxation causing these kinds of headaches, it might be tender right there. Is it tender there? Excuse me, is it tender there? Yes. I think we may have found the underlying cause of your problem. And it makes sense because this nerve goes right to there. And if you're not getting proper nerve supply, does it make sense that you could get these kinds of headaches? Why, yes, it does. Oftentimes, if you do have a subluxation causing these kinds of headaches, we may also notice spaciness, dizziness, mood swings, brain fog, eyes, ears, nose, throat, sinus issues. Again, they're reading it. It's right there. Do you get any of those? Why, yes, I do. I get sinus issues. That would make sense because this nerve doesn't just go to here. It also goes to here. It affects this whole area. Can you do me a favor? Can you circle C1? Put in an R because it's gone to the right. Can you go ahead and circle headaches and underline any of those things you have going on? Well, yeah, I have sinus problems and this and this and this, right? It's that simple. We use that same phrase, and you can see that I'm drawing their story out of them, right? I'm talking about them. They're very interested. I'm applying my story to their story, and it's dropping into the limbic system. And you're going to start to see that I will just agree with them. So let me ask you a question. If this is causing your headaches, and this subluxation is also causing your sinus problems, and we get those subluxation taken care of, what do you think would happen to your headaches? It would get better? Well, sure. What about your sinus problems? Wow, that would get better too? Yeah, you see, I'm using the Socratic questions. I'm talking about them. It's getting past the reptilian brain to the neocortex. You literally see them look up, send the information there, drop it in the limbic system as a new belief system. And then we just go on from there, right? And again, well, what would happen if it's causing this, but it's not causing that, and we got the subluxation taken care of? what would happen? Headaches would get better and sinuses wouldn't. I'd agree, right? You disagree with them. It's their story. Oftentimes, if you do have a subluxation going on here causing headaches and sinus problems, foregone conclusion, we might notice another one down about here. Is it tender there? Yeah, it's definitely tender there. That makes sense. Body just compensates. Let me ask you, do you ever get any pain or aching towards the end of the day right between your shoulder blades here? Yeah, I do. Well, that would make sense because when you're subluxated, those nerves go right to this area. And oftentimes, if you are subluxated in that area, we will notice gas, bloating, indigestion, heartburn. Did you ever notice any of that? Why, yes, I do. Well, that would make sense because this nerve doesn't just go to the mid-back, it also goes to the stomach and the gallbladder. If we're not getting proper nerve supply to those organs, does it make sense that it could be affecting your digestion? Right? It's that simple. You literally just go through the chart, usually find 2 or 3 main areas. At the end, they can go through and underline any other things they have going on, and you can correlate your findings for them. And then I'm just going to prove my case. Oftentimes, if you do have a subluxation causing headaches and sinus problems, mid-back pain and indigestion, low back pain, PMS, pain down the leg, we might also notice a limited range of motion. Do me a favor, turn your head to the left, turn your head to the right. Wow, do you see that it doesn't want to go to the right? Well, that makes sense because when you're subluxated, that nerve interference causes your muscles to pull on your bones to protect that area, to brace that area. And it feels tight and it feels stuck. Does it feel tight or stuck? Well, yes, it does. Then you must be what? I must be subluxated. 8-ball corner pocket. I drew their story out of them, took my story, applied it to it, asked them, then you must be what? And they say, I must be subluxated. It is as simple as that. Any of the tests you do, posture would be the same kind of a story. X-ray, spit, pee, and poop test. Here's what I expect to see on your scans, right? If you're doing scans, just whatever tests you do, either do it right then and there or build value. Show them why you're going to be doing this test. Okay, so now let's assume that you're any kind of doctor and you do hands-on work, but you also use nutrition, or you also do functional medicine, or that's all you do. All you do is functional medicine. So remember we said that in touch to last teach, you would touch the body if you were doing hands-on, or you would touch on a particular subject or on a particular questionnaire if you're doing more metabolic or functional medicine. You're going to use the skill set exactly like you did before. So all I have to do is help them understand. Let's assume in this case, we're doing stress hormones and we're dealing with someone that is having stress hormone problems, increased cortisol. All I have to do is help them understand the basic story. When you have to run from a lion, the natural thing your body will do is increase something called cortisol, epinephrine, norepinephrine. That's what it does. Okay, and the reason is so you can run. So what that cortisol does is it takes all the fuel in your blood, all the glucose, and it gets it to the big muscles so you can run. It's not storing it for later. It's getting it to the muscles now. But I also need a bunch of oxygen. So we're going to constrict the blood vessels and we're going to increase the heart rate so we can get the blood in, we can run. Now, is this the time to look at the lion and wonder how much it weighs or how big those teeth are? No, it's time to run. So that's a normal, healthy response. The problem is when we're stuck in fight or flight, when that cortisol stays high. Now we can't run from the lion, then relax. Heart rate goes back down, right? Glucose, everything goes back to normal. We're back into rest, digest, and heal. That's all we need to let them know as far as the story goes. We're going to use this same phrase now. Now let's assume that they've already filled this out. Here's the questionnaire, and they've put fatigue and irritability, digestive problems, and loss of libido, erectile dysfunction. So all I have to do is say, oftentimes when you do have an imbalance with your stress hormones, you have too much cortisol, that could certainly be causing your fatigue and irritability. And that would make sense because can you imagine if you're running from the lion and you never get to rest, digest, and heal, that you would constantly be fatigued. And oftentimes, if you do see that going on, we may also see some other issues. Now, they either underline them, or I would look at those with them and say, do you ever get any of these other things? So let's assume they say, yes, I do. I get digestive issues. Well, that would make sense because literally your body is sending the blood to the muscles for you to run. That's not sending it to the organs to digest. Does it make sense you'd end up having digestive issues? Or let me ask you, is this the time when you're running from the lion to get an erection? No, this is the time to run. So it's the same thing. Oftentimes, if you have an imbalance with your stress hormones, like too much cortisol, we would expect to see blank, and that would make sense because blank. It's such a simple, easy thing to do. Again, I think we found the underlying cause of the problem, and it's the stress hormone. So let me ask you this. If it's the stress hormone, if it's this imbalance in your nervous system causing the problem, whatever it is, however you practice, then what do you think the solution to that problem is? Well, I think I ought to do this. So if you're the chiropractor, would be get the nervous system working right. Let's give you some specific nutrients. If you're an acupuncturist, check the pulses and the chi. It doesn't matter. It's the same exact thing. So that's how we use touch, tell, ask, and teach. Okay, now what we're going to do is we're going to walk them through the whole story. But we're not going to tell them by educating them. We're going to ask them Socratically, how come? Because I want to get 100% of my information up to the neocortex for thinking, reasoning, and problem solving. And I want to take their information that I drew out of them, take my information, apply it to their information, drop it into the limbic system. I told you we get 100% of our information up there, not 25%. How will we know that we did? By asking them the appropriate Socratic questions. So if you were doing subluxation on the back of the brochure right here, you would just simply ask them. So let me ask you a question. Where are your subluxations? Well, they circled them, they underlined them, right? That's what we asked them to do. Where are your subluxations? What could they be causing? Sure. What probably brought them on in the first place? Well, in the history, we just talked about their crack cocaine use and years of football. What do you think would happen if we don't get it taken care of? Well, odds are it would worsen. I'd agree. What if we correct them and show you ways not to recreate them in the future? What would you hope for? How do you think you'd feel? I think I'd feel better. How about your future? Well, I think I could prevent all kinds of problems in the future. They're literally looking at this right here, but you're not telling them, you're asking them. Let me ask you this. Could you be healthier in 5 years than you are right now? Yeah, if we were to get proper nerve supply and quit recreating the same things over and over again, eat better, exercise, deal with stress, I think I could be healthier in 5 years than I am right now. So my goal is for you to not just feel better, but to have a better quality of life. I know it's not what you came in for, but it's what we see happen with our patients. So you tell me, subluxations, headaches, sinus problems, mid-back pain, indigestion, coated tongue, stinky armpits, explosive diarrhea. Just a back problem or an overall health problem? What do you think? Do you see how powerful and simple that is? It's all through Socratic questions. Remember, I'm drawing their story out of them, their favorite subject. I'm taking my story, applying it to theirs. It's such a simple thing to do. Now, the same thing applies if you were using the brochure or the handout with the stress questionnaire. You could have this exact same whole story there, and you'd ask them the exact same questions. What imbalance did we find? My stress hormones. What could it be causing? These problems. Well, probably brought it on in the first place. What happens if you don't get it taken care of? And if you do, it's the exact same process. So I hope you can see how incredibly easy and simple that is for you to implement. It is a skill worth mastering. I promise it will change your life. I'm just going to show you some context for the content. When we work with doctors, we have 3 phases: personal headspace, practice mastery, and going and growing. Phase one, we're just looking at the importance of certainty. Are you ready to grow and how to fix your contradictions? We then make sure that you have an operating system to run your business. I know how to run a successful business. I can build a dream team and maintain a dream team. We then have how to get our patients to get what we do and want what we offer so they stay, pay, and refer for a lifetime. This is one tiny piece of that program. We then look at how to bring in new patients, quality, ideal new patients. How do we stay in the flow and grow, anywhere from scheduling to bringing on associates, and then how do we go waitlist? So I hope that you see how valuable that can be. I hope it is something that you will put, I don't know, 30 minutes, 60 minutes into right now. Download the brochure, come up with your own, whatever works for you. Just start to use it with your patients. If you will do it, it will change your entire practice. They'll get who you are, they'll get what you do, they'll want what you offer. I am positive once you do this, you're going to want to get on Zoom with me and talk with me. So you'll see that we're going to give you an opportunity for a 60-minute strategy session. We can dive deep into exactly where you're at, where you want to get to, and how we might be able to help you get there. As always, much love and aloha.